Sifting through trash, secret travel, and working undercover, former FDA Inspector Peter Baker discovered what no one else saw.
What we found was terrifying.
Indian drug-making facilities supplying America's medicine using falsified data and operating in filthy, sometimes hidden sites.
This is called a shadow facility. We will never know about that facility. They'll make their products over there and then they'll ship them to what they call a show facility. And on paper, again, it looks like the product was manufactured there and meets a high standard for quality. But in fact, the quality of the product is unknown.
And what we found goes deeper. New secret locations that locked out FDA investigators, deaths tied to negligence, and the first proof that India-made generic drugs pose a greater risk.
Is it fair to say there is likely a significant problem with a significant portion of those drugs?
Yeah, I think there's very little question about that nowadays.
6 years after Peter Baker first exposed India's unregistered shadow facilities, we found they're still operating. We obtained this September 2025 FDA inspection report.
Investigators cited Hetero, a major maker of HIV, cancer, and neurological drugs, for running an unregistered testing lab, and somewhere in this village, storing critical ingredients in an undisclosed warehouse. When FDA inspectors arrived, workers ran and locked the gates, refusing entry for 2 hours.
What do you think would provoke the kind of response that workers would lock the gates and literally run away?
What they had is likely storage of products that were bound for export to the U.S. in storage. So during those 2 hours, what they'll do is they'll try their best to get those out through the back door, and so that the investigators can understand or document the true scope of the problem of which they are uncovering.
Once inside, inspectors found bird droppings on storage units and lizards and cats among active pharmaceutical ingredients. Hundreds of miles away, our crew tried to film another Hetero facility, previously cited for razors and screws in packaging. Security forced our cameras off.
How challenging was it for you and your team to put all the pieces together?
Extremely challenging, because the FDA will not release where a drug is made to the public, even through request.
Ohio State's John Gray spent years piecing together what is kept secret, where generics are made, and what happens when they fail.
What we found is pretty strong evidence. And the first time anyone, I think, has found large-scale, careful, empirical evidence that the same exact generic drug, that there were many more severe adverse events linked to the Indian drugs than to the domestic drugs.
Gray found a 54% higher likelihood of severe adverse events, including hospitalization, disability, and death, tied to generic drugs made in India. In the past 3 years, more than 300 children in Africa, Indonesia, Uzbekistan, and India have died from cough syrup tainted with antifreeze made by Indian companies. Criminals passed off the poison as a pharmaceutical ingredient, and factories turned it into medicine 4 separate times, as recently as this October. We found FDA warning letters from 2023 to Indian manufacturers, including Global Pharma, noting plans to export children's medications with a high risk of contamination from the very same deadly chemicals. The FDA was on the ground not because of the cough syrup, but because of another deadly crisis unfolding in America from a different product made in the same building.
She said, "You have an ulcer on your eye, that if we don't get this under control, you will lose all your vision."
In 2023, 4 people died. 4 had to have their eyes removed. 14 lost vision, and 114 suffered infections from contaminated eye drops made in India. Victims like Renee Martre were blindsided.
I would think I could trust them to make sure I'm not going to be hurt by something they bring in from overseas.
And it isn't just one company. Last year, Gledmark saw a massive recall of its blood pressure pills that were supposed to be extended release, but dumped the dose too quickly. At least 8 deaths have been reported to the FDA citing those pills, including Mary Louise Cormier of Maine. Months later, inspectors flagged contamination risk at the same plant. Only after those deaths and FDA inspection did the company recall 39 more drugs from U.S. shelves, from acetaminophen to seizure and blood pressure medication, all from the same facility.
For every violation that an inspector catches, how many do you think go unaddressed?
That's hundreds. The investigator may just see what is the tip of an iceberg. What's under the water is, of course, unknown.
A system built for cheap medicine that's costing far more than we think.
We contacted the drug makers. Global Pharma and Glenmark did not respond. Glenmark has denied responsibility for any deaths in its court filings. Hetero Labs told us it's working with the FDA to address the problems found. To read the full responses, go to spotlightinvestigates.com. For Spotlight on America, I'm Lisa Fletcher.